Hello, I'm Bob Challoner, President and CEO of Southampton Hospital, and I'd like to welcome you to another edition of Focus on Southampton Hospital, our monthly program about the events and goings-on here at your local community hospital. Today I'd like to welcome Dr. Paul Kelly, who's a member of our medical staff and an ENT, an ear, nose, and throat doctor with a particular specialty, and I'd like to talk to Dr. Kelly about his specialty and what he's been doing here. So welcome, Dr. Kelly. It's nice to have you here.
Thank you very much for the invitation.
Tell me a little bit about yourself first, how you ended up in a doctor, and then and more recently how you ended up on the east end of Long Island. So.
Well, believe it or not, I'm not from a doctor family.
Okay. I'm
actually from kind of the legal side of
Well, that's unusual
life.
to switch from lawyer to doctor.
Very much so.
Yeah.
But Long Island is a place that I vacationed when I was young. Okay. And was out 10 years ago with my family and met the managing partner of my current practice. And he says, you know, Paul, there's nobody that does what you do out here. Right. Would you consider bringing your ENT and facial plastic specialty out this way? We could use somebody that does what you do. And I have 3 girls, right. And you know, they come out for the summer, and they thought that it would be summer all year round.
Right.
They all agreed readily
right.
to make the move. We came from Houston.
Oh wow,
and,
that's a big change.
It's a big change, but it's been great. And
the beaches are nicer here than Houston.
I would definitely say that to be the case. Right. But I've definitely found a nice niche, and
that's wonderful. How? Tell me about the specialty. You're an ENT doctor.
Right.
So, we'll start with that. People
right.
always get confused. What is an ENT
Very
doctor?
much so.
Right.
So ENT is ear, nose, and throat. We take care of problems that involve those 3 main structures, right. both from a medical and a surgical perspective. Right. ENT's probably the most inclusive surgical specialty because we have lots of different subspecialties within.
Okay.
So ENT is our base. We learn all there is to know about the head and neck. And then from that base, many of us will branch into what we consider a super specialty. Mm. And so facial plastic surgery, which is both reconstructive and cosmetic, okay. is the field I chose. So after my initial training, I did a facial plastic fellowship. Okay. So that was a very busy year for me. I did boards for both ENT, and then I did boards for facial plastic surgery the same year.
Oh, wow.
That's 2 written tests and 2 all-day oral exams,
wow.
but well worth it. I love what I do.
How long was the fellowship you had to do for?
Fellowship was 1.5 years.
Okay.
And that was on top of the 5 years of ENT training to start. So the ENT gives you your base, in particular with nose, and nose is kind of my big specialty, if you will. And that's kind of how things progressed.
I'm always interested in how doctors get interested in a particular specialty, and how did you find yourself going down that very specialized path?
I don't think that I ever looked at facial plastics as something that I would do, and I think part of that is that a roommate that I had in medical school was brilliant, and plastics is what he wanted to do, and I thought to myself, well, you know, he's quite bright and he's very creative, and all of a sudden towards the middle of my residency I found that being called in the middle of the night to repair a laceration for a car victim was one of the things I loved to do.
Interesting.
And then I started mentoring with a couple of different directors that had a focus in facial plastic surgery, noses, skin cancer reconstruction, and I really loved it.
Oh,
and that was, so that was kind of the progression for me.
I have heard of very few ENT facial plastic surgeons. Is that a pretty specialized group?
It is a very specialized group. There are probably 1,000+ board certified facial plastic surgeons now. Wow. But we've been around for quite some time. I can't tell you the exact number of years, but it's an AMA equivalent board recognition specialty. Okay. With our own training programs, and we have our meetings every year, CME continuing medical education credits required, and we have great utility in what we do.
And you must be one of a very small number on Long Island. Do you have any sense of how
I want to say I know of 3 of us. that have board-certified facial plastic training. Within my ENT and allergy group, we have a division of advanced facial plastics.
Okay.
And we're probably the biggest group on the East Coast, if not within the United States, of board-certified facial plastic surgeons within this umbrella, if you will.
And you're probably the only one out here in the East End.
I'm the only one out here on the East End.
Must make you feel very needed.
It does. It does.
We have, and we're lucky to have you here. It's always a challenge to recruit specialists to the East End of Long Island. So
it's a great place.
I'm glad your daughters like the beaches.
Me too.
Yeah, that's right. So tell me a little bit about the subspecialty, I guess it is, or super specialty of facial plastic and the kinds of cases that you end up working on.
So I kind of group it into reconstructive and cosmetic. The reconstructive is quite busy. I deal with not only trauma, so I take a trauma call schedule. I consider myself preferred kid call.
Preferred what call?
Kid call.
Kid call? Oh,
so
okay.
If there's a young person in the emergency room, 2 to 4 years of age, for some reason I do very well with those, with that patient group.
Right.
I think because I have children perhaps,
right,
I don't know.
Right.
And I can get them
Never an easy situation.
Never an
dealing
easy
with
situation.
An injured child.
Exactly,
Yeah.
and especially when it comes to requirements for sutures and things of that nature. But so the reconstructive option, or the reconstructive part of what I do, is trauma. And I do a lot of skin.
Okay.
This is the island. This is the beach.
Right.
This is also the place of lots of skin cancer.
Right.
And skin cancers oftentimes require resections, and I provide the reconstructive efforts for those patients.
Okay.
I also have a reconstructive avenue in the nasal work that I do. Not only from a trauma perspective, but also from a cosmetic perspective.
Okay. So this would be nose surgery. I mean, we always hear about the nose jobs.
The nose jobs.
Often people think it's only a cosmetic procedure, but there must be a lot of different.
Correct. The nose is a very prominent facial feature, as you know.
More prominent than some of us than others.
Exactly,
Right.
and it has a dual utility, and that's what's oftentimes and in the past neglected, is that it's got a function.
Yeah.
And I tell patients that I hold both in high esteem,
Right.
but if it doesn't work well, it doesn't matter what it looks like.
Right, right.
And in order to cosmetically change a nose, you have to understand the function.
Right.
You know, it essentially is a tripod, if you will,
Right.
in the middle of your face that requires support. It has a function of humidifying, cleaning, and warming the air you breathe.
Right.
And sometimes modification of shape really modifies the function.
Right.
And so I do a lot of repair work for patients that didn't have good nasal surgery, or had nasal surgery that didn't pay attention to function.
Okay. So the people that, the bad nose jobs.
The bad nose jobs, the ones that you can spot across the room.
Yeah, exactly.
Yeah. Those patients suffer because they can't breathe, they suffer from infection.
Right.
They oftentimes have sleeping and going to sleep problems.
Right.
And
snoring, I would assume, is probably a challenge.
Snoring is a big component, and I always tell patients that come in for a snoring evaluation, and I always tease them because usually the wife or the husband is sitting there.
Right.
If I see the wife or husband, I know that either they're snoring or they can't hear.
Right.
One of the two. And from a snoring perspective, it's not bad.
Right.
But if it's associated with apnea, which is the stopping breathing component, then that's bad. And one of the first places we start in terms of correcting sleep apneic patients, for example, is with the nose. Okay. It's an insurance-covered benefit, and because we treat sleep apnea with a mask that actually provides some air pressure to kind of hold things open, if you will, the nose has to work.
Right. What type of technique do you use? Somebody that has sleep apnea on the nose.
Well, we're basically looking to just make function correct. Okay. So we want them to be able to have good exchange of air through the nose. Sleep apnea is treated with a mask that goes on the nose, that provides some positive pressure to kind of hold the airway open. Okay. So obviously if your nose is not functioning well, that pressure, number one, is very high and patients don't tolerate it, so they don't use it. Okay. And also they just can't be corrected otherwise.
Okay. Deviated septum, a term everyone hears about a deviated septum.
Yes.
Exactly what is a deviated septum?
So the septum is the center divider of the nose, and the septum consists of cartilage in the front of the nose and then a little bit of very thin bone as you go towards the back of the nose.
Okay.
And it really is the center divider.
Okay.
It's what separates the two nasal passages. It creates an airflow pattern that is considered laminar, which is kind of in lines. When the septum is deviated, one side is necessarily smaller because the septum is not in the middle. So it really just refers to that center divider being off kilter, if you will.
Okay.
And that leads to a whole plethora of problems, from dryness to the snore to infection to holding infections longer because of the airflow problems.
So it is an actual condition. I've always wondered.
It's definitely an actual condition, and many people are born with it and have it as kind of a part of them.
Right.
And I tell patients, when I do an exam, I talk to my patients, I educate, I explain, you have a deviated septum, it's to this side. If it doesn't bother you, it doesn't bother me.
Right.
We do have a small window of opportunity in terms of our life that we want to undergo procedures.
Right.
So we try not to operate after, a certain age group, for example. So we like to try to fix stuff that needs to be fixed. But just because you have one doesn't mean it has to be fixed.
Right.
It really, I look at the whole picture. I look at symptom complex and risk benefits for surgery versus doing nothing.
Right. Let's talk a little bit about facial plastic surgery and some of the risks and things. And when you see a patient, what are some of the typical, let's start with sort of nose surgery, some of the particular conditions that would prompt somebody or that you would recommend that somebody actually consider surgery as an option?
Well, surgery is always a personal choice. Right. And from a facial plastic perspective, cosmetic surgery is very personal. Right. I like to see patients making choices for themselves, not for others.
Right.
So nobody needs plastic surgery.
Right.
But it certainly is a wonderful gift we give ourselves. Right. I have many patients that will elect to do something cosmetic when they're doing something functional. Right. And functional surgery is obviously designed to help one breathe better, and cosmetic surgery designed to make one look better.
Right.
So we call it a breathe better, look better kind of package. And patients come in with complaints of a bump, a width problem, the nose is too wide, it's too long. Nasal surgery has really come quite a long way in the day, and I think that's why some of the old nose jobs are very visible, is that we had very little understanding not only of function but of form.
Right.
And nasal surgery from a cosmetic perspective is so much more than a bump or a tip. Right. It's rotation, it's how tall the nose is and projects from the face. And there are maneuvers that I do that are under the skin to modify the structure that creates the results we're looking for.
I'm always impressed with the fact that there's no scarring, and I guess it is all done from the inside out.
The majority is done from the inside out. I do oftentimes make a small incision on the center post of the nose that allows me to kind of access that center system just from a support perspective. It also allows me a little bit better direct visualization. So I do find that a number of my revision patients had what we consider an endonasal or a closed nasal approach, which I feel makes visibility a little less. So symmetry could potentially be a little challenged.
So you're more sure of the results, I guess.
That's correct. Just by being able to see in front of me. And it's a small field, but all the same.
Other sort of facial plastic surgeries that you do?
So, anything that has to do with reconstructive or cosmetic. So we've talked a little bit about the reconstructive, the skin cancer defects, whether it's a part of a nose missing, I can make a new one. Whether it's
make a new nose.
I can make a new nose. I can recruit tissue from areas within the face. We can recruit it from distant parts. We provide the support under the skin and then the skin cover. So that's one of the things.
From the person's own tissues?
Own tissues,
or it's
own tissues. From a cosmetic perspective, the whole gamut, from eyelids and facelifts, and I do a small number of implants, whether it's cheeks or chins, designed for symmetry and whatnot.
Right.
We also offer all the injectable treatments that are available that are considered the little things we do.
Ear surgeries also? I have very big ears. I wonder, can you actually make ears smaller?
Absolutely,
Right.
absolutely.
Right.
It's a great operation.
Right.
And for the young people, the 7 to 12-year-old group, that's usually when parents are bringing them in saying it's becoming challenging psychologically.
Right.
And believe it or not, there is an ear standard from an insurance perspective.
Is it really?
There is.
Yeah.
It's long in coming.
Right.
There is no such thing for a nose.
Right.
Perhaps that one day will be.
Interesting, because I think the nose is more prominent.
I would agree with you, but for some reason, there's a much higher psychological impact for young people with large ears.
Is it really? Interesting.
Than a larger nose.
Is that because maybe the nose tends to grow a little later in life or something?
It could be.
Yeah.
Could
What what advice do you have for parents? How young is there too young an age, or?
I don't think so.
Right.
I think that it's very patient driven.
Yeah.
I think that when your child comes to you and says, I have a feature, and I'll tell you a personal story that bothers me, I think that if it's something you can do, then by all means.
Right.
So my middle child, I have three girls,
Right.
and my middle child came to me one summer and said, Dad, I look like a monkey. I said, excuse me?
Right.
She said, well, when I get out of the water, my hair's wet, my ears are really big.
Yeah.
And one of my friends said, I look like a monkey, can you fix it?
Right.
I said, sure. I said, when do you want to do it?
Right.
She says, when does the pool close?
Right.
And I said, well, probably October.
Yeah.
So we did her surgery around Thanksgiving, and she has become this beautiful young lady with
Right.
amazing self-esteem.
Wow.
And not that I credit her procedure,
Right.
but certainly a factor.
Right. Absolutely.
It was not something now that she was self-conscious about.
Right.
So again, if it's something that's fixable and your child brings that to your attention,
Right.
I think it's an okay thing.
Any risk factors to consider?
Always.
Or,
Yeah. I think the risks are outcome issues.
Right.
From a safety perspective, I think if you go to somebody that's board certified, that is going to perform the surgery in a safe facility like Southampton Hospital, you have very little to worry about.
Right.
I think you have to do your homework, though.
Right.
And I tell that to all my patients. When I see consults, I say, you know, I'm going to educate you today.
Right.
When it comes to your nose, I draw pictures.
Right.
I show them the anatomy, and I say, whether you go with me or somebody else, these are the things you want to hear. I do a lot of talking about how to choose.
Okay.
And that's one of the things that I tell patients to listen for. You know, I want your doctor should educate you.
Right.
Your doctor should tell you the risks of the procedure. And your doctor should also be somebody who is approachable. If you have a problem post-surgery, you want, you know, and especially when it comes to kids,
Right.
you want to know that if there's something that's at issue, that it's fixable.
Because complications happen in any
They
type
do.
of surgery, and you do
Absolutely,
want to,
absolutely. And I think when the benefit outweighs the risk, it's time to have the surgery.
Is it possible, I know if you were going to do an addition to your home or something, the architects can do wonderful computerized renderings and things to show you what it will look like. Is that possible in your field?
Absolutely. I do have a computer imaging system, that's what we call it, and it does allow patients to see a goal for surgery.
Right.
I do emphasize that it's a goal towards which we work.
Right.
But I do show in my before and after book patients that have, you know, their before, their goal for surgery, the imaging system, as well as the outcome.
Okay.
And 99% of the time in our practice, we're probably better than we show.
Right.
Usually you're better clinically because it's a three-dimensional person,
Right.
whereas on a photograph it's not so much.
Yeah.
But it is a nice way for patients to have an idea. And actually it's a really interesting point that oftentimes loved ones respect the fact that their significant other, for example, is interested in making a change, but they don't want that person to look different.
Okay.
And I really explain to patients that you're not going to look different, you're just going to look like a better you.
Right.
And when they see the photos, they're like, oh yeah. And when they see the patient in real life, they say, gosh, you know, like 10 years ago.
Yeah.
And that's very comforting to them because they've fallen in love with a part, you know, perhaps.
Right.
You know, I love that nose, or I like how that chin line.
Right. They don't want to see
They don't.
a completely
No.
changed person.
And you know, and I preach a lot of conservative results in my practice. I like people to look natural.
Right.
I like people to say, that's a natural nose, right?
Right, right.
It's just so perfect.
Yeah, we do see the cases of people who've almost gone overboard and suddenly they just don't look real anymore.
It's true.
Yeah.
It's true.
Yeah.
And I'm hopeful that as the new climate for plastic surgery emerges, which I think is happening, we're going to see more natural looking results, and we'll kind of lose that overdone look. It won't be gone forever, and I think a lot of that's patient driven. But I think it's also supported, and I think that physicians have to be able to say, yeah, no.
Right, exactly. Okay, you've reached your limit.
Exactly.
Tell me about some of the other sort of plastic surgery options. I know you hear the terms of the injectables and the dermabrasion and things, and what sorts of things are you doing?
You know, there's lots of little things we do that we consider our little downtime, great result category. And that can be from simple skin care to glycolic or acid peels that help to reverse some of the damage done from our beautiful sun on the island.
Exactly.
But then there are some things that
leathery look that people say, is that possible to do
absolutely
something about that?
Definitely possible to correct. It takes time. And you don't have to go to the laser, which potentially limits your downtime and limits your ability to enjoy our communities. But you can do skin products at home that are relatively aggressive that help to turn over skin. Aging skin does...
What do you mean turn over skin?
Yeah, so aging skin does two things. It fails to exfoliate as well as it did, and that starts to lead to that sallow, kind of thick look. And then it also starts to pigment irregularly. So you start to get blotchy and splotchy. So youthful skin, look at a kid, they are very smooth, they have even pigment. So we start with a skin line that addresses that. And once we make that correction, not only does it look better, but it's healthier. The skin line that we use in our office is called Allergy, and it has a corrective component. So all of my skin cancer patients, I suggest evaluate the program. If they come in with one spot, very likely they have others. And we'd like to be proactive. I work very closely with a couple of dermatologists in our community. Not only the surgeons that refer patients who have had skin cancer removed, but also the dermatology docs that have lasers that do things that I don't. But so the little things we do, we'll start with good skin care, start to correct the damage that's been done. And then we divide skin aging into quality and quantity. So quality is the texture, it's the color. And there are certain things that address the quality, and there are certain things that address quantity. So quantity is kind of a surgical thing. So if you're starting to have the jawline that's sagging or the upper eyelid that's got a little too much skin, there's no amount of creams that are going to fix that.
What causes that sagging?
It's an elasticity change. And oftentimes sun is to blame. Collagen changes, all of those kind of things. We preach safe sun. Only 2 or 3 years ago, we used to go into the elementary schools and do a sun talk. All of my kids and their friends have heard my talk. Towards the end of the year when they don't have a whole lot to do, they say, Dr. Kelly, would you like to come in and talk about safe sun? So we say, sure. But you know, the sun damage that creates our changes as we age happens before the age of 18.
Oh, really?
It does. And so I'm a stickler for my children, who are all blonde and blue, to wear that sunscreen. I know you're going to look pale and pasty, but guess what? When you're older, you'll think
that'll be a difference.
So we do the skin, the skin correction, and that makes some great changes. We talked about the quantity, which is surgical removal of extra stuff. And then sometimes we'll do volume changing, meaning that as we age, our facial volume has a tendency to fall. So we'll add volume back with fillers, for example.
These are the collagens?
These are the collagen-based products. We don't actually use collagen much anymore.
What is collagen exactly?
Collagen is a natural component of skin. It's part of the architecture, part of the support structure. In the day, we used to offer collagen as an injectable. It was bovine or cow-based, and it kind of fell out of favor. And now we're using more natural components of skin that have been incorporated into filler products. Very healthy, reactivity issues are almost zero. You do want to have a good injector. And the utility there is wonderful. So it provides volume in areas that have lost volume, gives the skin something to sit on.
Right.
You see the lady who's very thin, that's great, but her skin kind of hangs
Right.
on the face because there's nothing on which it should sit.
Okay.
So by adding volume back to the face, we see a lot of improvement in terms of youth.
Okay.
The other subset of injections are the neuromuscular products, such as Botox, Dysport, and those products are designed to soften muscle function, which relaxes wrinkling. It takes away the muscle's action on the skin,
Okay.
which then allows the skin to kind of revamp itself and to soften.
Muscle is overreacting somehow?
Not necessarily, but when we smile, we expect to see a crow's foot,
Right, right,
if you will.
right.
But when we're not smiling, we'd rather not have them.
That's right.
And by relaxing the muscle, that skin has a chance to not crinkle
Okay.
so actively every day.
Right.
And it thickens itself and kind of releases that wrinkle. A wrinkle is actually an anatomic thinning of that second layer of skin.
Oh, all right.
And the top layer of skin simply sits into that layer.
Okay.
And that's where a wrinkle comes from. So they've actually done histologic studies to show that. So the Botox actually relaxes the muscle, which then allows that skin to revamp itself and fixes wrinkles.
Are there things we can do to reduce the wrinkling in our skin?
Absolutely.
Or,
And again, the biggest one we can do is to practice safe sun.
Okay.
And that's the use of a sunscreen every day, regardless of whether you're sitting in the sun. Just driving in your vehicle from your home to your office is sun exposure.
Yeah, you're right. I never think about it. It's pretty intense
Absolutely, it
sometimes
can
right on your
be.
face. Yeah.
We see a lot of the male counterparts with skin lesions and skin defects on the left side of the face because they oftentimes are driving the vehicle.
Right.
And their spouse, who may
Yeah.
be sitting in the passenger seat, has more on the right side. We're seeing
Interesting.
less of that nowadays
Yeah,
because
yeah.
women are certainly
Driving as much.
exactly. But in my 70 and 80-year-old patients, that's where we're seeing those changes. But the sunscreen is one of the most important things you can do every day. Sunscreen itself has actually come a long way. We've, sunscreen protects us through not only a chemical block process, but a physical block process.
Okay.
You remember the day when the lifeguard had the Desitin on his
Right.
nose. It was
Yeah.
a big white nose.
Right.
Well, believe it or not, we're moving back to physical blocks in sunscreen as compared to the chemical blocks. The chemical blocks have actually started to be perhaps linked to poor changes in the skin
Oh, really?
that may lead to other issues such as precancer changes and or cancers.
Oh, really? So you may actually be
Correct.
creating more of a
You may
risk.
be potentiating. So
Right.
nowadays we're looking for sunscreen products that have zinc oxide, titanium dioxide,
Okay.
and less of the chemical mediators. So we're looking for physical block sunscreens. It does have a tendency to make you look a little white.
Right.
But you can mix it with a bronzer and it
Right.
takes that away.
Takes it, right.
Yeah.
People who've had surgery, especially, are they more at risk for sun exposure? Or,
Not necessarily. It certainly depends on what kind of surgery.
Right.
If they're having skin cancer surgery, then clearly there's sun damage that's
Right.
there. If they're having elective surgery, the risks are no more than others. There is a suggestion that a scar does have a potential for cellular change that could lead to the skin cancer realm.
Okay.
But the skin incisions that are used in my field are so camouflaged that it's not so much an issue.
Yeah, I've always been amazed when I've seen people have had plastic surgery, just where
It's tough
is
to
the
see
scar?
where it was.
Yeah, exactly. Right.
And we do that on
So-
purpose.
Yeah,
Yeah.
absolutely. So, well, unfortunately, we're out of time, and I really appreciate your spending some
My
time
pleasure.
with us,
It's good to talk
Doctor.
to you.
And, certainly with all of the sun and the exposure and, even people I know sometimes it's if they've had a disfiguring accident, it's very depressing and demoralizing. So certainly it sounds like there's a lot of hope and a lot
Just
of things can be
educating
done.
that we're here is, half the battle. We
Right.
can fix those things and make it all work.
And your main office is in Aquabog?
In Aquabog and then here in Southampton.
In Southampton also, and I know we'll be, for ENT Allergy Associates, we'll be showing on the screen actually the
Absolutely.
number where people can get a hold of you.
Beautiful.
And we advise people to give your office a call and talk to you if they have a question. So
Happy to do so.
wonderful. Thank you for making yourself
My
available.
pleasure. Thank you.
And I'd like to thank all of you for tuning in today and listening or watching, and I'd like to thank our friends at CTV for producing and airing the show in Southampton, and the folks at LTV who show our program in East Hampton. And I'd like to invite all of you, if you have any questions or concerns, to give my office a call at 631-726-8555. If you need help navigating the system, getting in touch with Dr. Kelly, we'd be more than happy to put you together with him. Thank you for listening, and good health, everyone.